Welcome to the deep dive.
Hello.
Today we're looking at something that, well, it might seem really basic, maybe even a bit mundane.
Personal hygiene habits.
Exactly.
Yeah.
But our source material, it suggests these habits hold some surprisingly vital clues about our health, especially for older adults.
That's right. We've been looking at a YouTube transcript, and it really focuses on specific hygiene mistakes that elderly people might make.
And crucially, the kinds of things doctors notice immediately and why they pay attention.
So our goal here is to unpack the 7 key areas that this source highlights.
We want to understand why these seemingly small details matter so much to doctors. Because, as we'll see, they can reveal a lot about the bigger health picture.
And there are some real eye-openers in here. One point the source even calls shocking.
Right. So the overall idea from the source is pretty striking, isn't it?
It really is. It suggests doctors can potentially spot serious health issues just by noticing certain, let's call them hygiene errors.
These habits aren't just about looking clean or, social niceties.
No, they're framed as potential silent warnings. Signs of dangerous conditions may be developing under the radar.
And the source claims this kind of observation, this knowledge, isn't widely taught or discussed.
Even though paying attention could apparently be life-saving in some cases.
They shared a story, didn't they, about a man named Harold.
Yeah, Harold, 75. He thought his personal care was fine, But during a routine checkup,
His doctor spotted 3 critical hygiene clues, things Harold hadn't thought twice about.
and those clues ended up revealing a serious underlying condition he had absolutely no idea about.
Wow.
Harold apparently said later that his pride nearly cost me my life when talking about one specific issue we'll get to. It really underscores the potential impact.
Okay, let's dive into the first area then. Number 1, neglecting oral hygiene.
And what's key here is the direct link doctors see. It's not just about teeth and gums in isolation.
Right. Poor dental care is connected to really serious stuff. Heart disease, stroke, even dementia.
And there's research cited to back this up. Geriatric specialists, like those mentioned from Harvard Medical School, they found bacteria from untreated gum disease can actually get into the bloodstream.
And cause inflammation, leading to dangerous heart conditions.
Exactly. Their studies apparently show seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems.
3 times. That's a huge increase in risk.
It is, and it's something people might easily overlook, like the anecdote about Sylvia, 68 years old.
She ignored her bleeding gums, thought it was just normal aging.
Pretty much. But her cardiologist found dangerous inflammation in her heart valves, and it was traced directly back to that oral bacteria.
He told her waiting longer could have caused irreversible damage. Scary.
Very. So what's the practical advice here, according to the source?
Well, first, look at your toothbrush. Is it over 3 months old? Frayed. Get a new one.
And they suggest maybe considering an electric one. A UPenn study apparently found they remove, 62% more plaque?
Significant difference. Also, be thorough. Brush twice a day, 2 full minutes. Use a timer if you need to.
And floss every night. Consistency is key there.
Don't forget regular dental checkups either, even if you wear dentures. Gums still matter.
Absolutely. And the main warning signs to watch for?
Bleeding or swelling in the gums. The source is clear. These are not normal aging. They're warning signals.
Good point. Okay, moving to the second clue doctors watch for, infrequent bathing and skincare.
Again, sounds simple, maybe even a bit personal, but the source frames it as a missed chance for observation.
Well, think about it. Skin is your largest organ, right?
Yeah.
So its condition is like a huge external indicator. It can reveal internal issues, diabetes, liver problems, heart conditions.
And sometimes before other symptoms show up.
That's the idea. Dermatologists, like those mentioned from the Mayo Clinic, warn that bathing less often can actually hide early signs of these problems.
Hide them. How so?
Well, if you're not washing and looking at your skin regularly, you might miss subtle changes. Their study suggested nearly 40% of undiagnosed conditions in older patients could potentially have been caught earlier through better skin observation.
Wow. There was another story about Clarence.
Right, Clarence, 77, he bathed maybe once a week, especially in winter, worried about dry skin.
Understandable concern.
But during an unrelated checkup, his doctor noticed some unusual skin discoloration, and that observation led to an early kidney disease diagnosis.
Which had been missed because he wasn't bathing often enough to notice the change himself, or for it to be obvious sooner.
Exactly. So the advice is pretty straightforward. Establish a regular bathing routine. The source suggests aiming for at least 3 times a week.
Use mild, fragrance-free soap. And definitely apply moisturizer right after while your skin's still a bit damp. Helps lock it in.
And maybe most importantly, regularly examine your own skin. Look for changes.
What kind of changes?
Things like persistent dry, flaky patches, unusual discoloration, like with Clarence, or areas that itch constantly and won't stop.
These aren't just cosmetic annoyances then.
They could be signals from your body about something internal, worth getting checked out.
Okay, clue number 3. Ignoring nail care.
Yeah, fingernails and toenails. Seems minor, maybe, but doctors look closely.
Why? What can nails tell you?
A surprising amount, actually. The source says their condition can indicate over 20 different systemic diseases.
20? Like what?
Things like anemia, thyroid problems, even heart disease.
That's incredible.
Research cited from the American Academy of Dermatology found that in patients over 65, looking at nail abnormalities led to diagnosing undetected internal conditions in almost 30% of cases.
Nearly 1 in 3. Just from looking at nails.
Makes you think, doesn't it? The story about Beatrice, 82.
Oh, right. She had thickening, yellowing toenails.
Yeah, and she just thought it was, part of getting older, tried to hide them.
But a podiatrist saw them.
Exactly. Diagnosed a really advanced fungal infection, but the implication of that infection was a severely suppressed immune system.
Which then led to finding a serious underlying condition needing immediate treatment. All starting from ignoring her toenails.
Crazy connection. So, the practical advice.
Trim nails regularly. Straight across, slightly rounded edges. Keep them clean and dry.
Wear breathable shoes. Change your socks daily. Common sense stuff, maybe.
But the key message is, never ignore changes. Color, texture, thickness.
If your nails become brittle, discolored, or thickened, the source emphasizes these aren't just inevitable signs of aging.
They're potential signals. Pay attention.
Definitely. Okay, now we get to the one the source called shocking. Clue number 4. Improper incontinence management.
What makes it shocking, according to the material?
I think it's the combination of how incredibly common it is, affecting over half of seniors in some form, and how often it's hidden.
Hidden due to embarrassment.
Exactly, and that silence, that hiding, has serious health consequences.
Right, it mentions things like dangerous skin infections, higher risk of falls, social isolation.
But also, and this is critical, hiding incontinence can mask serious underlying medical conditions.
Like bladder or prostate cancer.
Yes. Urologists mentioned from Johns Hopkins Medicine report that seniors who actually manage the issue properly have 60% fewer complications.
That's a huge difference. And the story about Douglas, 73, that was powerful.
It really was. He was too embarrassed about occasional leakage, used makeshift things instead of proper products.
Until he developed painful sores.
Right. And by the time he sought help, doctors found an advanced prostate condition. Could have been caught months earlier.
And he said his pride nearly cost me my life.
Yeah, that really hits home.
So the message here is really strong. Never feel embarrassed to talk to your doctor about bladder or bowel changes.
They see it all the time. It's a medical issue.
Use the right absorbent products if needed. Change them promptly. Keep the skin clean.
And the absolute key takeaway is that incontinence is not just a normal part of aging.
It's almost always a symptom, right? Something that needs medical attention.
Definitely. If you find yourself planning trips around bathrooms, or having even occasional leaks, or using pads just in case.
Those are warning signs. Talk to your doctor.
Absolutely. Okay, clue number 5, ear hygiene errors.
And this is specifically about how people clean their ears or try to.
Yeah, apparently many older adults unintentionally damage their hearing or miss infection signs because they're using the wrong methods.
Like cotton swabs. This source really warns against those, doesn't it?
It does. Otolaryngologists, ear, nose, and throat doctors state that improper cleaning, especially inserting things deep into the canal, causes nearly 40% of ear canal injuries in people over 65.
Leading to infections that could have been avoided.
And the story about Patricia, 71, is a stark warning.
She used cotton swabs regularly inside her ears.
Yes, until she actually punctured her eardrum.
Wow.
Led to a severe infection, emergency treatment, and permanent hearing damage.
All from a cotton swab. Something so common.
And the source says it was completely avoidable.
So what's the safe way then? The rule they give is pretty memorable.
It is never insert anything smaller than your elbow into your ear canal.
Good rule. So just clean the outer ear.
With a warm, damp washcloth. That's it. If you think you have wax buildup.
Use ear drops specifically for that. Following the instructions carefully.
Right. And if you have pain, discharge, or any sudden hearing changes, see a doctor immediately. Don't try to self-treat.
So if your ears feel itchy, full, blocked, or your hearing changes.
Get professional help. Don't stick anything in there.
Makes sense. Okay, number 6. Poor foot hygiene. Why are feet so important?
Because they hold vital clues about your circulation and your nervous system.
So doctors check them closely, especially in older patients.
Often one of the first things they check. Foot problems can be the earliest signs of diabetes, neuropathy, that's nerve damage, and vascular disease.
And the statistic about diabetes-related amputations was just staggering.
It really was. Podiatrists cited from the American Podiatric Medical Association say proper foot care and regular inspection could prevent up to 85% of those amputations.
85%. That's almost unbelievable, just from basic care and observation.
Highlights how critical it is. And the story of Raymond, 76.
He ignored dry skin and minor cuts on his feet, assumed it was just aging.
Yeah. But his doctor noticed them during a routine exam, immediately ordered diabetes tests.
And caught it early, when lifestyle changes could still make a big difference.
Exactly. Raymond himself felt he could have gone years without knowing, risking much worse complications.
So the practical steps are pretty clear. Wash and dry feet daily, especially between the toes.
Crucial. And inspect them regularly. Look for cuts, sores, blisters, changes in skin color or temperature.
Where clean, dry socks, natural fibers, or moisture wicking are good. Apply moisturizer to dry areas.
But not between the toes, right? That can trap moisture and lead to fungal issues.
Good point. And the big warning. Never ignore foot pain, numbness, tingling, or wounds that just aren't healing.
See a professional right away for those things.
So if you notice your feet are consistently dry, cracked, have slow healing cuts, weird discoloration, or loss of feeling.
Don't just write it off. It could be an early sign of a serious systemic condition.
Okay, finally, number 7. This one felt a bit different. Medication-related hygiene issues.
Yeah, it's not about cleaning habits per se, but about how medications can affect your body in ways that manifest as hygiene changes.
Like changes in body odor, or sweating, or mouth dryness.
Exactly. And these changes might actually be signals of dangerous side effects or even that a medication level is becoming toxic.
The source mentioned pharmacologists from the American Geriatric Society.
Right. They've documented how certain common medications can cause these kinds of changes. And their research suggests nearly 40% of adverse drug reactions in seniors first show up this way.
As changes in hygiene needs, like odd smells or sweating, before more obvious, serious symptoms appear.
That's the finding, which is pretty surprising.
The anecdote about Barbara, the retired nurse, really illustrated this.
Yeah, 67 years old, developed an unusual body odor. Her family just thought, maybe she wasn't showering enough.
But her geriatrician recognized it.
Immediately, as a potential sign of medication toxicity that was starting to affect her liver.
And she was showering regularly, using deodorant. She had no idea the smell was internal, related to her meds.
Shows how easily it could be missed or misinterpreted.
So, the advice if start new medications.
Track any changes related to hygiene. Keep a simple journal. Maybe note differences in body odor, sweating, mouth dryness, skin reactions.
Stay hydrated, unless your doctor advises otherwise.
Report unusual sweating or odor changes to your doctor immediately. Could be a sign of drug interactions or side effects.
And definitely never adjust medication doses yourself, even if you suspect a problem. Always talk to your doctor first.
Absolutely. So the key takeaway here is not to automatically dismiss unusual body odor despite bathing or excessive sweating or extreme dry mouth as just getting older.
What could be crucial warnings about medication effects, potentially serious ones.
Exactly. Needs prompt medical attention.
So wrapping up this deep dive, the core message, based on this source, seems really powerful.
It really is. That proper personal hygiene isn't just about appearance or being polite.
It's presented as a whole set of vital health indicators, things doctors can read for clues about your overall health.
Yeah, it really emphasizes the potential impact of simple self-observation and making small, consistent efforts in these 7 areas.
And addressing these things isn't just about preventing the obvious, like infections or bad breath.
No, it's highlighted as a way you might potentially catch serious conditions much earlier, which can help maintain independence, dignity, quality of life.
It's quite a shift in perspective on something we might take for granted. So what's the final thought for you after going through all this?
For me, it's seeing how interconnected everything is. Caring for your mouth, your skin, your nails, managing continence, ear care, foot care, monitoring medication effects.
They seem like separate little tasks, don't they?
Right. But this material suggests they all weave together, reflecting the health of your body's systems. It makes you think, maybe the biggest warnings really do come in these small, unexpected forms.
Hiding in plain sight. waiting for us or our doctors to notice them.
Well,
Makes you want to pay a little closer attention, doesn't it?
It certainly does.